Removal personal protective equipment is conducted at the patient's doorway or outside the room and perform hand hygiene immediately. The order for doffing are gloves, goggles or face shield, gown, mask or respirator, and lastly, perform hand hygiene. The contaminated areas when doing the doffing are outside of gloves, front of the gown, gown's sleeves, front of mask or respirator, and front of face shield or goggles. How to remove gloves? First, press the outside of your glove with your opposite gloved hand and peel off. Then, hold the removed glove in your gloved hand. Slide the finger of your ungloved hand under your remaining glove at the wrist and peel the remaining glove off over the first glove. Dispose of both gloves into the clinical waste bin. Clean your hands with alcohol hand gel before proceeding to the next step. Next, remove the gown. The front of the gown and sleeves are considered contaminated, whereas the ties on the inside of the gown are considered to be clean. Therefore, avoid touching the front of the gown and sleeve. Carefully untie or break the ties of the gown. Peel off the gown by removing the thumbs from the inserts if present, and then move the shoulders and arms up through the gown, which helps allow the gown to slide off the body. Then from the inside, with the assistance of the arms, roll the gown away from the body by turning it inside out, form it into a ball, and discard them. How to remove gloves and gown together? First, pull the outside of the gown to break the ties of the gown, and then pull the upper part of the gown on the shoulder and take each side with the opposite hand to start folding the gown from inside to outside. The gloves are removed in the folded gown to prevent any contact with contaminated area. Form them into a ball and discard into the clinical waste bin. Clean your hands with alcohol hand gel before proceeding to the next step. Lastly, removing of the surgical face mask. By using both hands, grasp the elastic ties around your ears, stretch them, and carefully pull away from your face. Dispose the mask into a clinical waste bin immediately. Perform hand hygiene. Wash your hands with soap and water or rubbing your hands with alcohol hand gel.